Welcome back to News This Week in Nursing Homes. I'm Nurse Bug. First up, staff training key to fulfilling behavioral health in nursing homes. LTC experts are calling for urgent improvements in staff training to address growing mental health challenges among nursing home residents. Currently, 20 to 40% of nursing home residents face serious mental health conditions, including depression, dementia, schizophrenia, and anxiety disorders. A striking trend is the increase in younger residents, many under the age of 65, entering nursing homes often with complex behavioral health disorders. Nursing homes typically rely on psychiatrist-centered, nurse-centered, or multidisciplinary team models to care for residents. However, implementing models effectively requires specialized training to appropriately respond to residents' needs. Comprehensive care often involves medications, psychosocial and emotional support, and even housing assistance to help residents lead more fulfilling lives. The prevalence of serious mental illness in nursing homes surged to 77% in the past decade, with 50% of Medicaid beneficiaries aged 22 to 64 in facilities receiving antipsychotics. To address challenges, government initiatives like the Federal Center of Excellence for Behavioral Health in Nursing Facilities, which was launched in September of 2022, aim to provide resources and training to improve care for residents with mental health and substance use disorders. Despite progress, nursing homes face obstacles such as fluctuating staffing levels and a regulatory environment penalizing use of certain medications. The Moving Forward Coalition, established in 2022, continues to add advanced solutions to improve nursing home care, highlighting the needs for consistent, well-supported training programs. Experts stress while treating mental health in nursing homes is challenging, with the right resources and education, it's achievable. Next, new compliance guide signals the Office of the Inspector General's intent to hold individual executives and investors liable for nursing home missteps. The industry's segment-specific compliance program guidance had its first major update since 2008, emphasizing accountability at all levels. The 59-page guide highlights expanded risk areas, providing recommendations for mitigating compliance issues, evaluating quality programs, and addressing potential safety concerns. While it does not carry regulatory authority, guidance reflects OIG's priorities and serves as a warning to those responsible for compliance efforts at both facility and corporate levels. One major focus is on related party transactions, where funds from the federal healthcare programs may be misused through inflated payments of operational expenses, benefiting owners and investors rather than the resident care. OIG is particularly concerned about tunneling, a practice of hiding profits while diverting resources from resident services. Updated guidance broadens the definitions of responsible individuals to include not only administrators and executives, but also private investors. OIG also reiterates commitment to monitoring critical areas like staffing levels, infection control, emergency preparedness, employee background checks, adverse event reporting, and medication use. Guidance is designed to help nursing facilities proactively identify and address quality and safety concerns before harm comes to the residents or leads to enforcement actions. The document emphasizes the need for rigorous compliance and quality measures to safeguard residents and the federal healthcare programs alike. There's a clear message: greater accountability and transparency will be demanded across the board. The Federal Trade Commission expands the rule protecting older adults from tech support scams. The FTC expanded its telemarketing sales rule to include inbound telemarketing calls for tech support services. Announced on November 27th, the new amendment aims to protect consumers, particularly older adults, who initiate calls to companies offering tech support through advertisements or solicitations. Older adults are especially vulnerable to these scams. Last year, Americans aged 60 and older lost $175 million to tech support fraud, according to the FTC. Additionally, the FBI reported overall fraud losses for older adults reached $3.4 billion in 2022. Scammers often use pop-up alerts or messages claiming a device is infected with malware to lure consumers into calling fake tech support services. Once connected, they demand payment through difficult-to-reverse methods like wire transfers or gift cards for bogus services. The amendment to the TSR ensures consumers are protected not only from incoming fraudulent telemarketing calls, but also when they initiate contact with deceptive companies. The change builds on earlier versions of the rule, which established the National Do Not Call Registry in 2003 and addressed pre-recorded calls and deceptive business-to-business communications in later updates. The FTC developed the latest amendment following a public comment period, during which it reviewed 25 submissions. Emphasizing this expansion will help curb scams targeting vulnerable populations and promote accountability in the telemarketing industry. Thank you for joining me for News This Week in Nursing Homes. To get more of QSource news and info, visit qsource.org to view podcasts, sign up for the newsletter, and remember, for all of your quality improvement needs, call the Q.